Okay. All right. We've got Tiasha Bailey, the executive director of the Susan G. Komen here in Chicago. Thank you so much for joining us.
Thanks for having me. I'm excited to be here.
I feel like all the medical talk we've done over the last weeks and months has been about the virus. Unfortunately, even those without the virus have other health conditions to deal with, and some of them are not even addressing them because of the virus. How are you handling cancer screenings?
Yeah, so we've done our best to really try to put forth some emergent guidelines to help women during this time and making sure they have an understanding of when to engage care. And so we released some guidelines back in March, letting them know, if you've had a routine screening mammogram in the past year, that you could delay your care and that those that were currently in treatment or experiencing symptoms to continue seeing their provider. We have since made some updated guidelines telling women that they can now move forward with those routine screening mammograms and to contact their provider to learn about next steps in terms of protocols and ensuring their safety while they're accessing the system.
Not even can continue those screenings, absolutely should, right? I feel like
Absolutely.
everything I've heard is people are now avoiding going to hospitals and doctor's offices because they're worried.
Yeah, I mean, I think that at the height of the pandemic, that was a very valid concern, and people were concerned about overburdening the system. And I think we've moved past that quite a bit, especially here in Illinois. And we want women to get those routine breast cancer screening mammograms because prevention is key.
What do you say to a woman who might be saying, all right, I'm not going to ignore it, but I'm going to wait 3 months just to see how things are. Maybe I'll even wait 6 months. I can't imagine that that's a good way of thinking.
No, I mean, I would just encourage her to pick up the phone and make that appointment, call your healthcare provider and ask any questions that you have, and what your concerns are. And they're able, I believe that they are able to address any of those concerns and make sure that people can get in and get those screenings done and or any other treatment that they are in need of at this time.
All right, so kind of flipping the tables a little bit because A, you want people to get their cancer screenings, very important. But B, Susan G. Komen is a huge fundraising organization, and all of those virtual races we do are now having to go virtual. How is that working?
So just like many other organizations, we have had to pivot. Our signature events are not happening in the way that we've routinely done them, and we miss being in front of our stakeholders and having that face-to-face time. But we are working like other organizations to host virtual events. And so we're excited that our race for the cure will be happening in October and October 24th. And this coming Friday is our third annual Metastatic Breast Cancer Conference. And we're super excited to be bringing that to everyone virtually.
How is it going to work out?
Yeah, so we're encouraging everyone to register on our website. And so it's a free conference. I do want to stress that it's a free conference open to the public. Our theme this year is Empower Your Resilience, Mind, Body, and Soul. So it's a comprehensive approach to women living with metastatic breast cancer, but it's open to survivors and caregivers and practitioners so that they can learn from the best and the brightest out in the field and just learning about emerging practices to keep everyone healthy.
Yeah, I would imagine even if you are a wife or a mother or a sister, someone in your family who had it, this is good information to have if you don't have it yet yourself.
Absolutely. And again, we have world-renowned practitioners that will be at the table, and we have a patient panel. So we have individuals that are thrivers and survivors that will be sharing their experience. They will be answering questions from the audience. So it'll be, although virtual, it'll be a very engaging, exciting full day with giveaways and all that jazz.
We focus so much on everyone's waiting for the coronavirus vaccine to come and all that. What has changed recently in terms of research and education and care for breast cancer?
I think people are looking at it from a more holistic approach. And so looking at, the changes around legislation with medical cannabis, that is an emerging field and definitely something that there's more science around and being able to use cannabis safely. And we know that women living with metastatic breast cancer, it's another option to help around kind of pain management. We're seeing some real movement in individualized treatment plans. And so using women's genomic profile to determine the best route for cancer treatment. And that is really exciting.
Yeah, I feel like so many women, you'd hear the term breast cancer and it was immediate death sentence for so many women for so many years.
hmm And that has continued to change. I mean, I think we're learning more and more about how the disease shows up in different individuals, which I think is so important around the science with respect to the individualized treatment plan. So it means even though I may come to you and I have been diagnosed as a stage 2 breast cancer candidate, based on my genomic profile, my treatment plan could look very different than the woman sitting next to me with a very similar diagnosis. But really helping, these changes have helped to improve outcomes dramatically.
Yeah, all of this again comes down to getting that screening, because the earlier you guys can catch it, the better everyone else is going to be.
I agree. We say it all the time. Detection is key, and it's the key to improved outcomes and just making sure that women are living longer.
Is it still 40 is the recommended age to start, or are we starting sooner now?
I think we're starting sooner. It
Okay.
really depends on your family history. And something that we talk a lot to our constituents about is knowing your family history. Is there a presence of cancer? You know, has your grandmother been diagnosed with breast cancer? Is she a survivor? And so all of those questions are important, and making sure that you're sharing your history with your provider, because that will determine the the best course of action for you. So there's some individuals, because of their familial history, they're getting mammograms as early as 25.
Wow.
And so we just want people to know it's not a one size fits all situation. So do your best to learn about your family history and share that with your practitioner.
And again, a lot of the information that you're probably going to need moving forward, you can get this weekend starting on the 21st. Give me the details one more time.
Yeah, so you can join us on Friday, August 21st for our metastatic breast cancer conference. All of the details are on our website, www.komenchicago.org. We also have our Race for the Cure, our annual event, which is our huge event that we bring everyone together in person. Will be happening virtually on Saturday, October 24th. All of the details are there. Both events are free. I want to stress that the registration for our Race for the Cure is free this year. And this is the first time ever that we've been able to do that. And we just want to encourage participation and to bring people together to build awareness around a cause that we're all so passionate about.
Yeah, it literally affects everybody in this country, whether you are married, you have a mom, you have a sister, you have an aunt, or you're a woman yourself.
Absolutely.
Thank you so much for joining us. We appreciate it.
Absolutely. Thanks for having me. Take care.
Take care. Good luck this weekend too. I hope everything goes well.
Yes, thank you so much.